Hello, welcome to the 8th Annual Accessibility Awareness Days event. I'm Sherry Gagno, Accessibility Manager in the Office of Human Rights, Equity and Accessibility, and the moderator for the event this year. So glad you could join. This is the second of 5 short workshops that will be held from 11:30 to noon each Tuesday in March. The theme this year is, It's Accessible, but Is It Inclusive? Each week, the presenters will share a 20-minute presentation, leaving time for a short question and answer period. Please type your questions in the chat box during the presentation, and we will address them at the end. If you require closed captioning, look for the 3 dots in the menu bar and scroll to the bottom of the drop-down menu and select Turn on Live Captions. Before I get into introductions, I have one more announcement. Each week, we will draw 2 names out of the list of attendees for a $25 Indigo gift card. Winners will be announced the following week. I'm happy to announce winners from last week's draw, Dr. Phoebe Lamb and one of our students from social work, Dana Ellis. Congratulations. You will receive an email shortly with more details. This week's topic is accessibility, inclusion, and the limits of the law. This week's presentation takes an interview-style approach. The subject matter expert is Dr. Laverne Jacobs, who is a law professor at the University of Windsor. She is a disability and human rights expert informed through her professional work as a strong advocate for equal rights, as well as through a personal lens as a person with a disability. Dr. Jacobs is the founding director of the Law, Disability and Social Change Project at Windsor Law and is an innovative researcher examining current legal and policy issues to help foster disability inclusion. Dr. Jacobs is a regular consultant and contributor in Canada's policy and development and public debates and has held appointments on the Human Rights Tribunal of Ontario and the Ministry's Advisory Council for the AAD. Interviewing Dr. Jacobs is Nadia Shivratan, who is a Juris Doctor candidate at the University of Windsor and a BBA graduate from Wilfrid Laurier University. She is currently a research assistant for Dr. Jacobs and a student researcher for the Law, Disability and Social Change Project. She most recently founded a nonprofit initiative called Law Links that connected over 100 law students who lost employment due to COVID-19 to volunteer opportunities across Canada. It is now my pleasure to turn the presentation over to Nadia to begin the presentation.
Thank you, Sherry. Now, this interview has been set up to discuss the impact of equality law when it comes to accessibility and inclusion. In particular, for the theme of this event, it's accessible, but is it inclusion? I was particularly intrigued by the idea in your abstract that the law, especially accessibility legislation, may be limited in the ways that it can assist in achieving disability in Canada. Can you elaborate on this idea, Dr. Jacobs?
Yes, absolutely. Thank you for the question, Nadia. Before I begin, I just want to take a moment to recognize the traditional territories of the Indigenous peoples on Turtle Island. I'm currently situated in Windsor, and the University of Windsor sits on the traditional territory of the Ojibwe, Ottawa, and Potawatomi. I'm grateful to be a guest on this land, and I'm grateful to be able to share this virtual space with all of you and with our audience. To your question, the first thing that I would like to say is that the law is designed to be the principal tool through which we aim to eradicate barriers to inclusion and participation in society faced by members of the disability community. Through legal interpretations over time, constitutional law through the Charter, and other forms of equality laws, such as human rights codes and now accessibility legislation, aim to develop a better society for people with disabilities by implementing both the social model of disability and the human rights model of disability. Now, I know that last week you had a chance to hear quite a bit about the social model of disability. I'm just going to say one quick thing, which is that the social model of disability understands disability as emanating from barriers in society encountered by individuals with impairments, and does not locate disability within the individuals themselves. The human rights model of disability, which I've also mentioned, adds to this by ensuring that the emphasis is on rights as opposed to charity, and even more recently, through the United Nations, has highlighted the elements of participation, inclusion, and intersectionality. But the problem is this: regardless of whether you are using a process based on litigation to pursue one's rights, such as bringing an action under the Charter or a human rights complaint under a human rights code, or whether you're relying on the most recent wave of equality rights instruments, namely accessibility legislation, which is designed to be proactive in setting standards that would identify and remove barriers before they become a problem for members of the disability community. Regardless of which one of these two avenues you choose, the law has shown us significant limitations in actually achieving social inclusion on the ground. There are a number of examples of this in areas such as healthcare, education, community living, and employment, to name just a few. And I think that the end result is that there still is a considerable amount of work to be done by all of us, and debates to be had outside of the legal context in order to ensure that there's respectful inclusion of people with disabilities in everyday society. We need to appreciate and support the dignity of people with disabilities in the same way that we appreciate and support the dignity of all human beings in our spaces. Thank you.
Thank you, Dr. Jacobs. Now, despite COVID-19 exposing significant barriers for people with disabilities, much of the focus has been primarily on the health and safety of the public in general. What strategies do you see for achieving disability inclusion as we progress during this time?
Thank you, Nadia. There has been a significant oversight, I think, of the rights of people with disabilities during the COVID-19 pandemic. This has been particularly troubling, I find, since people with disabilities have faced a range of barriers throughout the pandemic, such as healthcare issues and issues relating to income security. Turning first to healthcare issues, we see risks to the health of people with disabilities constantly throughout the pandemic. For example, from living in congregate homes, such as long-term care facilities, or from the inability to obtain appropriate hospital care. There have been instances, including one fatal one in British Columbia, of people with disabilities having to obtain hospital care without communication support. The fatal incident that I'm talking about in BC saw a nonverbal young woman die in hospital after her communications worker was not allowed in with her. What is unfortunate is that the disability community, disability advocates, had been warning that a situation like this might occur. After her unfortunate death, there were changes in hospital policies, but it took a death for us to get there. We've also seen barriers affecting people with disabilities in relation to income security and economic inequality. And these concerns, which are about having enough money to support oneself and one's family, that's the essence of these concerns, are the issues that are facing the largest number of people with disabilities in the country during the pandemic. So 50% of people with disabilities are unemployed, and this has been a fairly constant statistic over the last several years. This number contrasts with only 21% of Canadians without disabilities who are unemployed, and you can see that that's a significant disparity. Through the COVID-19 pandemic, we saw an exacerbation of this situation. A study by Statistics Canada that came out in August showed that 36% of employed people with disabilities reported job loss since the time that the pandemic started. Now, this had a considerable and a very tangible effect on the quality of life of people with disabilities who lost their jobs. And the Statistics Canada report showed that 40% of those who participated in the study and talked about income loss said that they had difficulty obtaining food and groceries. So certainly we've seen aspects of income security. So how do we remedy this? To use the language that you used in your question, you know, what strategies can we employ to bring about disability inclusion in COVID times? I believe that there are three things that need to be done. First, we need to pay more attention to developing inclusive treatment. Second, we need to pay attention to developing more inclusive social safety nets. And finally, we need to pay attention to developing more inclusive recovery strategies in relation to COVID-19. And I'll just elaborate a little bit on this. With respect to having inclusive treatment strategies, A very strong example can be taken from the battle over triage protocols that started shortly after the lockdown. So information had been leaked that the Ontario Ministry of Health was developing a triage protocol that placed people with disabilities at the bottom of the list for care should there be a shortage of equipment. An inclusive treatment strategy would have had people with disabilities at the table from the beginning in order to avoid this result, which was clearly discriminatory. Instead, what we had was advocacy for months to fight in order to have people with disabilities properly respected within the triage protocols. With respect to inclusive safety nets, the second strategy that I think we need to adopt, I see something similar. The fundamental idea here is that people with disabilities should be considered in the development of all social safety nets, and any unique circumstances pertaining to people with disabilities should be taken into account. So just to give you a quick illustration here as well, you'll recall that the Canada Emergency Response Benefit, the CERB, was provided to people with disabilities several months after being provided to other Canadians. The amount for people with disabilities was also far less than what was provided to other Canadians. So in any given month, the amount that that individuals with disabilities received in total was less than half than what an individual received in any given month who had applied as a Canadian. Most people with disabilities indicated that this was both unsatisfactory and in fact insulting. And again, I think it's something that could have been avoided by an inclusive approach to developing this emergency benefit. So the third strategy that I talked about was an inclusive recovery strategy. And I think here we need to find ways to ensure that people with disabilities are not left behind as we emerge out of the pandemic. Ensuring vaccines for people with disabilities is a good example. So many people with disabilities are at a significant risk of death if they contract COVID-19. Yet consultation and proposals to vaccinate people with disabilities has been piecemeal at best across the country, according to news reports. So it's important that people with disabilities be consulted and brought into the decision-making table for the development of law and policy. Brought to the decision-making table for the development of law and policy. Even more important, and I talk about this in my forthcoming book, is that people with disabilities need to be actually heard. If we're unable to develop policies that are inclusive, then we're faced with bringing lawsuits after the fact. And lawsuits, of course, have a myriad of problems. They're expensive. One usually has difficulty to bring a lawsuit on their own as a self-represented litigant if they cannot afford representation. And litigation can take considerable time and can be draining on energy. And so it's very important that we think about how we can address these issues from the get-go.
Thank you for that very insightful answer, Dr. Jacobs. Now, in what other areas do you see issues relating to accessibility and inclusion arising where accessibility for people with disabilities may be present, but inclusion is not?
Thanks, it's such a good question. I think that when it comes to people with disabilities, the single most pressing issue in Canada that we're facing outside of COVID-19 at this very moment deals with medical assistance in dying or MAID. Amendments to the relevant legislation are soon to be passed that will enable people to access MAID in the most extensive fashion ever in our history. However, there are many difficulties connected with these legislative amendments. One difficulty is that the legislation states explicitly that people with disabilities can seek medical assistance in dying, even if they are not reasonably close to death. Another difficulty is the way that the legislative amendments have been presented. The changes have been prompted by court cases that suggest that people with disabilities want to have medical assistance in dying if they are suffering and in pain. While that might be true for some people with disabilities, it is not true of all people with disabilities. In fact, there are a significant number of disabled people who are terrified that they will either be explicitly or implicitly pushed into seeking MAID because they do not have the social supports they need to live a dignified life. And by social supports, they're talking about basic necessities of life in some cases, such as food, or in other cases, appropriate home support. I can give you an example of the former. In September, there was a news report, about several individuals who were living on ODSP, the Ontario Disability Support Program, during the pandemic, and who were applying or considering to apply for MAID. Individuals on ODSP live essentially at or below the poverty line. These individuals in particular spoke of needing to make choices between food and medication in any given month, and they could barely pay their rent. Moreover, we know that the lack of sufficient food is a common concern amongst people with disabilities living on social assistance. I think that MAID shows us how equality law, through the charter in this case, has made something, quote, more accessible to people with disabilities, namely medical assistance in dying, but through an eclipsed view that does not take into account the lived realities of a significant part of the population of disabled people. The current approach to MAID is not only under-inclusive, it also sends a very dangerous and stigmatizing message about people with disabilities. It suggests that people with disabilities have lives that are less worthy than living, and it entrenches that idea within the law. Let me just say one final thing about medical assistance in dying as well. It's this. I think we need to bring in more information about the diverse experiences of various marginalized groups within the disability community itself. I'm referring here to people who are multiply marginalized and who live at the intersection of disability, racialization, gender, poverty, etc. Issues of poverty, for example, tend to affect people within the disability community who are women, Indigenous peoples, and racialized individuals more significantly. We need to do a better job of tracking this type of data so that we can work to address, through law, the disproportionate negative lived experiences of people who are at the intersection of living with disability and other, sometimes multiple, disenfranchised social identities. And just to wrap up, you had asked about other areas where we see accessibility, but not necessarily inclusion. And I can just add a couple of others. Access to education is a big one. Students returning to school throughout the pandemic or with disabilities, and finding that the materials are not necessarily accessible. So that's another one. And I repeatedly hear concerns as well about social exclusion, just generally in schools, work placements, and other settings where people with disabilities are, of course, involved.
Thank you, Dr. Jacobs. Now moving on to the last question of the interview portion. How can we achieve social inclusion generally for people with disabilities in Canada? And what advice do you have to give people working as part of the disability rights movement and to the public generally?
Okay, well, in listening to your question, I'm reminded of a quote by Verna Myers that was recently brought to me by a student. And the quote is, "Diversity is being invited to the party. Inclusion is being asked to dance." For disability advocates and the public generally, I would say that in order to truly have that dance, in order to really achieve a society that's diverse and inclusive, it's necessary to build thoughtfully and respectfully on the foundational building blocks that have already been set down. Although I think that the law has shown limits, I also think that the very fact of having equality laws, such as the Charter, human rights codes, and accessibility legislation, provides a stepping stone for us to move forward. And I'll just say quickly, for disability advocates, I think it's important to participate as much as possible, as much as you can, keeping within the limits of wellness. I think that society needs to hear our experiences because they have a hard time knowing of experiences outside of what's portrayed as a dominant norm. At the same time, I think that the general public has an obligation as well, not just to listen, but to educate themselves about the lived experiences of people with disabilities. This can be done in a myriad of ways, and it can be information, for example, through the Senate website on MAID. So finally, I think for lawyers, it's important to build legal arguments in ways that aim for inclusion, not just access. and this may mean bringing in interveners where possible to show the impact of certain decisions on people with disabilities. Thank you.
Well, thank you very much, Dr. Jacobs and Nadia, for having this discussion. Some very important issues this morning that have been raised, a lot to think about. If you have, at this point in time, if anyone from the audience has any questions, you can start typing those in the chat box, and I will moderate the questions for Dr. Jacobs. While we wait for people to input their questions, I want to let everyone know that the sessions will be recorded, and when we have the links available, we will send that to everyone who has registered for the Accessibility Awareness Days events. So there is a few questions here. I'll start with one that was submitted early, and it was asking about undue hardship. And at what point does undue hardship and burden take precedent over legally providing accessibility?
Okay, that's a wonderful question. And basically, when we talk about undue hardship, we're within the realm of reasonable accommodation, a part of equality law. Undue hardship is a limit. So essentially, accommodation should be provided to the point of undue hardship. What it means usually is looking at things like costs. So if we're talking about a workplace, for example, are the costs to provide accommodations exorbitant? There are also safety concerns that are often brought in within this kind of legal doctrine. So are there safety concerns to others in the workplace that could be affected? Things like that. But generally speaking, the doctrine of undue hardship is it's a very high threshold. Throughout the law, we have been we've seen cases that have essentially tried to provide accommodations, provide accommodations for people with disabilities, and that rarely, or it's not too often that you see a case where undue hardship is presented successfully.
Okay, thank you. Just dovetailing on your last question, there was a question here about, can you tell us how disability advocates are organizing in response to proposed changes to MAID?
Oh, sure. I'm going to start off with one very big initiative that's taking place right now, and that is a filibuster on Bill C7. There will be content presented probably 24/7 for the next while by disability activists and advocates arguing against MAID and showing essentially how people with disabilities live and also the reasons why MAID is problematic for people with disabilities. So that's one way. Other ways that disability advocates have been organizing against MAID include appearing, before the House of Commons, before the Senate, making arguments there, submissions, etc. And I think just really speaking wherever possible on the issue. There have also been a couple of organizations and groups that have been formed. I'm thinking of the Vulnerable Persons Standard, and they too have been, organizing to show people the challenges that MAID will pose to a very significant portion of the disability community.
Okay. As a disability ally, how could people support the disability community at this time?
That's a great question. And I think that as a disability ally, it's necessary to find out what those with disabilities would like to say, and then work with people with disabilities in order to bring that forward. So, I think it's just a matter of getting involved, getting to know some people with disabilities, and finding out what they are organizing and how you can contribute in that way.
Okay. Another question that was submitted is, do you believe the use of pre-existing conditions has affected the medical treatment of those with disabilities during the pandemic?
That's a good question. Honestly, I don't have enough data to tell you that. That's something I'd have to look into. It's an interesting question, though. I have not come across that information, so unfortunately I don't have a response.
Okay. Here's another question that has popped up. When we look at students with a disability and full-time versus part-time studies, should the institution be offering them the ability to still get full-time student benefits? This has especially been an issue around health benefits.
So the question is whether they can still get full-time benefits if they are part-time due to disability accommodation.
Yes.
Yeah.
Yeah, that would be the question.
Mm-hmm. Well, I mean, I think it's maybe best to think of that question in an inverse way. So I think the question then would be, is it fair if a student needs to go part-time because of disability to not allow them to have the benefits, the healthcare benefits and other benefits that other students are having? So, I mean, to me, it strikes me that it's possibly unfair to deny benefits if that's the case. But you know, every case has to be looked at case by case. So I'd need more detail, but that's my general sense. I think it might be best to look at that from the inverse.
Okay, thank you. And we have a few minutes left. There's another question that was submitted in advance, and it goes back to the undue hardship question. Does undue hardship and high monetary costs prevent governments, such as municipal governments, from creating a city that features an accessible built environment? And how could these undue hardships or financial barriers be overcome within various levels of the government?
Well, that's a good question too. Undue hardship, again, is really a high threshold. So not only do we have kind of a test that should be or is rather difficult to meet, but we also now have, with accessibility legislation, another prong that proactively is suggesting that we have accessible spaces, including accessible built environments. There's a specific set of standards relating to the built environment. So unless there's something really unusual, something that is extremely exorbitantly costly or causing, as I was saying before, issues of safety, I wouldn't see how undue hardship could prevent the accessibility legislation from coming into play. And moreover, I mean, the two of them should be working in tandem to facilitate participation and inclusion of people with disabilities.
Okay, I think we have time for one more question. How can provincial and federal levels of government ensure that individuals with disabilities that are immunocompromised, are prioritized in receiving the COVID vaccine?
Mm-hmm. No, that's a good one as well. Lots of good questions this morning. So how can we make sure that they are prioritized? I think that it's a question of doing some data searching. So, finding out, how many people with disabilities there are, figuring out who is immunocompromised, and hearing stories. So this is the lived experience piece that I was talking about in my interview with Nadia. So making sure that we hear about the ways in which people are immunocompromised, because it may not be evident, right? It may not be that you realize, for example, that someone in their daily routine, will have to get transportation, will have to be strapped in, will have to, encounter many different people in a day. And so I think we need to hear these kind of detailed, granular, lived experiences as part of the determination of how to plan for the vaccines.
Well, we have 1 minute left, so I'm going to take this time to wrap up. And thank you, Dr. Jacobs, and thank you, Nadia, for participating this morning. It was a very interesting discussion. There were a few questions that we couldn't address, but we will keep track of them. If anyone has questions that they would still like answers to, please feel free to email them to at uwindsor.ca. That's for Accessibility Awareness Days, AAD at uwindsor.ca, and we will try to get back to you. Also, you're welcome to join us next week from 11:30 to noon. Next week's topic is going to be human-centered design, presented by University of Windsor's own Dr. Mojarodi, and we look forward to that discussion. Thank you, everyone, for attending, and we will see you next week.